Hello everyone, my name is Tin and this is my persuasive speech. It could be at least one time in your life you might smoke or you might see someone smoking or dying due to the smoking related issues. According to CDC, Centers for Disease Control and Prevention, more than 16 million American people live with a smoking related disease. If you are not smoking, you are still in the smoking hands. According to healthline.com, overall, WHO, World Health Organization, estimates that 1.2 million premature deaths per year are related to secondhand smoke worldwide. And according to cancer.org, secondhand smoke has the same harmful chemicals that people who smoke inhale. There is no safe level of exposure for secondhand smoke. Secondhand smoke is known to cause cancer. It has more than 7,000 chemicals, including at least 70 that can cause cancers. I have researched this issue and I can confirm that all the information is reliable and this issue is necessary to care about. During my speech, I will provide evidence that support my position that we have a responsibility to minimize the effects of smoking to everyone's lives, solutions to minimize the effect of smoking, and what benefits those solutions might have. First, I will demonstrate how smoking affects to the health of first-hand smokers as well as second-hand smokers. According to CDC, cigarette smoking remains the leading cause of preventable disease, disability, and death in the United States, accounting for more than 480,000 deaths every year. In 2019, nearly 14 of every 100 U.S. adults aged 18 years or older currently smoke cigarettes. This means an estimated 34.1 million adults in the United States currently smoke cigarettes. And smoking leads to the disease and disability and harm every organ of the body. More than 16 million American people are living with a disease caused by smoking. For every person who dies because of smoking, at least 30 people live with a serious smoking-related illness. Smoking causes cancer, heart disease, stroke, lung disease, diabetes, and COPD. Secondhand smoke exposure contributes to approximately 41,000 deaths among non-smoking adults and 400 deaths in infants each year. Secondhand smoke causes stroke, lung cancer, and heart disease in adults. Children who are exposed to secondhand smoke are at increased risk for sudden infant death syndrome and mild ear disease, more severe asthma, and slow lung growth. Recently, I have demonstrated how smoking affects the health of first-hand as well as second-hand smoker. Now I will explain how smoking affects to medical costs and our economy. According to CDC, smoking-related illness in the U.S. costs more than 300 billion each year, including more than 225 billion for direct medical care for adults, more than 156 billion in lost productivity, including 5.6 billion in lost productivity due to secondhand smoke exposure. Now I have explained the effects of smoking to health of smoker and effect to medical costs and our economy. Now let's discuss about how we can minimize these effects. There are several ways we can minimize effects of smoking to people's lives. Let's talk about the first solution. Promote understanding about smoking effects in families, schools, public places, and communities. There should be programs in school in every levels to educate students about smoking harms and action programs to stop smoking. Parents should educate their kids about smoking harms and stop smoking for their children to follow. There should be the marches to warn people about smoking harms. Recently, I have explained how to promote understanding about smoking's effects in families, schools, and communities. Now let's talk about the second solution. Increase the price of tobacco products is the single most effective way to reduce cigarettes consumptions. According to CDC, a 10% increase in price has been estimated to reduce overall cigarettes consumption by 3 to 5%. Research on cigarettes consumption suggests that both youth and young adults are 2 to 3 times more likely to respond to increase in price than adults. Lower income populations are more likely to increase quit items or smoke fewer cigarettes in response to price increase. Although desire to quit and successful cessation may not be consistent across all racial groups. So now that you are aware of the solutions, let's now talk about discuss about the benefits of those solutions. There are several benefits to these solutions. By understanding smoking effects to oneself and others, people will be less likely to smoke. There would be less smoking related disease and deaths, disease medical decrease medical costs and economy effects. Imagine we live in the families, uh, communities that are free of smoking harms, and everyone is healthier, living in the healthier environment. That could be a very good place to live. Today I have talked about effects of smoking to health, medical costs, and our economies. Explain the solution to minimize those effects and what benefits those solutions might have. We have a moral and ethical responsibility to help minimize the effects of smoking to our health and our medical system as well as our economy. Thank you for your time and attention regarding these important issues.